The training was highlighted as a critical intervention for the media. Abubakar Sankano, Deputy Director of Press and Public Relations at the Office of the President, underscores the intensive support the Merck Foundation provides to Gambians, channeled through the Office of the First Lady. He detailed the foundation's contribution, which includes advancing girls' education through its impactful Linda program by offering scholarship to underprivileged girls, in addition to providing scholarship for healthcare professionals.
We've been working with the Gambia government under the leadership of President Barrow. With the patronage of Her Excellency, the First Lady Fatima Barrow. As you know, Merck Foundation, they decided to focus on working with First Ladies because they have played an important role in every community, in every society, in every country. So therefore, having First Ladies as ambassadors, as partners, is something that has added value to the work of Merck Foundation. In the Gambia, they've been working with First Lady Fatima Barrow, Her Excellency, since 2017. A lot has happened. Scholarships we have given to Gambians, at least 94 scholarships. As you know, studying medicine takes time. Gambians went abroad to study medicine in various fields, and they are back in the country serving. And over 2,000 people benefited also for training. So this is an ongoing capacity building. And then with this 12th edition that is taking place in Gambia, we have what they call health media training. Because we realize that all this information about media, about healthcare, the media plays an important role in disseminating it. Because people, if people don't know certain health issues, they will not be able to understand. So, for instance, the issue of stigma relating to fertility, both male and female fertility, the media's role is very important. So today's training session is build the capacity of the media to ensure.
The president of the Gambia Press Union, Aissatou Keita, described the Merck Foundation's capacity building as crucial. She emphasized that the training will afford journalists the opportunity to understand the intricacies associated with complex issues like infertility and diabetes, among others.
So this is very crucial. It's going to give journalists the unique opportunity to be able to understand most of these things in terms of the myths, the stigmas around them, but also to give a diversified perspective of these issues and getting it from specialized medical doctors who will actually talk about these issues in terms of diabetes, hypertension, issues of FGM and so on in a greater perspective. That gives you a perfect understanding on what these issues are, some of the impacts it has on the human health, and then how do we also see some of the efforts that has been done by governments and when it comes to these areas. So when you look at it, we stand at this intersection of the public and also the public policy makers. Most of the times policy documents are made when it comes to these issues in question, but the understanding becomes difficult, especially for those people that consume information. So us being in the intersection of this, we need to have the understanding of these things so that we will be able to loosen it and to be able to put it into context for people to be able to have broader understanding of these issues, how to prevent them.
Echoing these sentiments, Dr. Musa Marena, a reproductive specialist, stressed the dispensable role of the media in healthcare reporting. He noted that healthcare workers are limited in their reach without the media, which plays a critical role in informing the masses.
Misconception. For every disease condition that you see, there are a lot of misconceptions. Even the healthcare system that we have, there are a lot of misconceptions. I think what media could do is to visit these health facilities and see for themselves at first hand, not just hearsay, not just what people say. When I come to the media and complain about something, I think it is good that the media goes out to that individual or even that facility to verify, because verification is very important. People have different intentions, different ideas, why they are doing what they are doing, why they are saying what they are saying.
The tangible benefits of the training were evident in the testimony of participants. Mbaikor, a health reporter for Star TV and one of the beneficiaries, expressed how the day-long program had significantly enhanced his skills in reporting on infertility and the surrounding misconceptions.
It will really equip my health reporting way, because I know now exactly when it comes to the stigma, particularly the infertility, I can able to make some difference in it. Today I've gathered knowledge here that were very difficult for me to designate or to separate when it comes to infertility. The Gambian concept, I can say, If I'm wrong, I stand to be corrected. But majority will center this infertility problem to ladies, not to men, because the concept men have, hence possibly you can function, it means you are fertile. No, but the training have equipped me in a sense that I expect high, and I will change my reporting and narratives when it particularly comes to infertility, and I will equally be someone who will be counseling people. Instead of going to others, let them first visit the hospital.
The capacity building program organized by the Merck Foundation is expected to serve as a game changer for media reporting, particularly when addressing sensitive issues such as child marriage, infertility, and diabetes. For Star TV, I am Moto El Baji.